We are now going to learn about the services of the Warm Handoff Program. First responders or concerned friends or family members play a life-saving role when administering naloxone to the person experiencing an overdose. But this is just the first step on the journey to recovery. Once the individual enters the emergency care unit, medical needs must be immediately addressed. Just as important is to ensure that the individual is connected to drug and alcohol treatment resources. The Warm Handoff Program was established to make these vital connections, to provide the overdose survivor with the support and guidance to begin the recovery process.
We provide drug and alcohol services to individuals that show up into the emergency department. For whatever reason that may be, some people come in specifically asking for help with their drug and alcohol use. Other people come in because they've had maybe an accident or a fall, and the doctor recognizes that maybe some kind of substance use was involved. So once they're medically cleared, they'll give us a call.
We quite frankly, prior to the program, didn't have a lot of help for somebody that would come in with an overdose, and they might overdose, and we had some medical help that could help them start breathing again. But we didn't really know what the next step was. And what invariably we would do is provide the patient or their family with a telephone number or an address to go get help. And unfortunately, we found that we weren't being successful, that process was broken. And that's what created the Warm Handoff, meaning that we actually walk the patient through the process from the 911 service through the admission or outpatient therapy at the rehabilitation center. One other thing that we did is we made it part of our treatment pathway and our treatment team. So we don't, at this point, ask permission from a patient, because many times a patient will say, I don't need it. But we feel that the physicians and the nurses know what the patient needs, much like when we order an x-ray or a blood test or a medication or any other consultation.
I go over, I talk to the medical staff, I review the notes in the computer, in the Epic system. I review the notes, I talk to the medical staff. So I would prefer to talk to the nurse who has this patient, who actually has talked to the patient, and kind of get an idea. It's like, wow, what do you think this person wants to do? And let's say the person said, well, I want to go to rehab today, type of thing. And then the conversation starts. I go in there, identify myself, and say, what brings you here and what can I do to help? And so the conversation continues, and they talk about their drug and alcohol history, maybe past treatment experiences, and the $64 question, are you ready to go right now?
The program itself is staffed with certified recovery specialists.
A certified recovery specialist is someone in long-term recovery who has gotten the training and passed the exam and continue education every 2 years to help folks enter and maintain long-term sobriety. TASC has been very generous in training people to get the certified recovery specialist, the CRS. So some people are a good fit, but they don't have that certification. So TASC has made arrangements to train those folks to get that certification.
The idea behind it is that we can relate maybe a little bit more with the individual, share our experience with them, offer some strength and some hope that, there is an opportunity for you to change your life, with just taking one step with entering treatment. And we can just share how things were for us and just let them know, it is possible. We're living proof of it.
They understand these issues and how to solve them much easier than someone who can't relate as on a really a primary basis to having this disease. So it's sort of like when you look at other diseases and you see people with breast cancer have support groups, because these people have all gone through it and can help each other navigate. The recovery specialist is kind of a brand of that.
When the warm handoff program first started, it was designed as a way to address the existing opioid use problem out in the community.
We expanded the program now to cover more than just opiates. So the NIM, or one drug we still see, is alcohol. And we know that that is a disease as well, and that needs to be treated. We also now have made it so that you don't really have to suffer an overdose to take advantage of the warm handoff. And quite frankly, you don't have to even come in for that. You can come in for another reason, and if it's identified that you have a substance abuse disorder, the warm handoff is available to you.
There is a high volume of people that come in that just don't know where else to go, or they come in for other reasons. But in the end, we make a connection and offer help to someone, to change their life with their substance use disorder. One individual sitting down with another individual and just having a conversation with them, and even if it doesn't amount to a treatment placement, we can offer them information, we can offer them support, we can offer them the knowledge and information they need, so if they make a decision in a week from now, 3 days from the time of our meeting, they know exactly what they need to do in order to get the help they need.
There's no one, including myself, that's involved with EMS that doesn't want to see their patient do well. And so why it's so important in EMS is that obviously we follow what we need to keep the patient alive, to make sure that they are breathing, to make sure that they have blood circulation. But we also need to know that there is hope and there is a cure for the disease. So when you come in with a gunshot, and EMS brings patients with gunshots, very quickly they know there's support at the other end to get them to the operating room. And if they're having a heart attack, to get them to the catheterization lab. And for EMS to know that getting someone to the emergency department will enable them to get into a program like this that will get them into recovery, which right now is the cure.
It feels great. I still get, anxious kind of butterflies when a consult comes in, and that is the way the doctor contacts our program. Grab the clipboard, get some information, going out to talk to someone, and it's still a very good feeling at the end when it is a successful treatment placement. But it's also a good feeling if it's just a good conversation with someone and you're providing them some information and some experience, like, look, you're not alone in this.
Well, I get to see people at a point that I can really make a difference, because I share my experience and my using and my sobriety. I share my experience, and when they get it, or if I plant the seed, that's in God's hands when I plant the seed. But if they agree, I'm just facilitating. This is well beyond my pay grade. If someone's ready, that means good. I was able to help facilitate this part of your journey. So it's very rewarding. I enjoy my work.
I would just like to say thank you to the first responders, to the police officers, to the fire department that is out in our community, and part of their job is bringing people into the emergency department so they can try to get the help they need.
As you can see, the Warm Handoff program serves as the bridge to treatment and recovery services for any drugs, from opioids to alcohol. Our next video looks more closely at these treatment and recovery resources.